When a patient is missing a tooth and it's been missing for quite a while, the body doesn't have the stimulation in the bone where the root used to be. And so bone grafting is required to go in and trick the body into growing more bone in that spot. We use a combination of cadaver bone, we'll use some bovine, and we'll harvest bone. We'll use autogenous bone from the patient's own body, and we'll mix that together.
All that does is act like a lattice work that tells your body that there is a bone in the area that needs to be solidified, and your bone over a period of time, usually about 6 to 8 months, grows into this area and solidifies it into your bone.
Bone grafting is very safe. All the materials are approved by the FDA, and we use them in a manner that is consistent with clinical research.
If nothing is placed in the bone, over time your bone will resorb in height and width. And a dental implant, when it's placed in the bone, be it for a single tooth or for a full arch option, as you chew, it internally stimulates the bone to stay where it needs to be.
The best guy in the world, in my opinion, in bone grafting was Dr. Istvan Urban. I saw him at a meeting in California in 2016, and his cases were amazing. I got online and figured out how to go to Budapest and study under him. When I got there, we hit the ground running so fast. We learned about how to use membranes reinforced with titanium mesh for the vertical component, how to pin those membranes in place with surgical instruments to fix the membranes so that the bone underneath is very firm and stable. The first step is an initial consult with me. We'll take an ICAT scan. We want to give them every bit of information that they need during that consult to make a good decision about their health. Some of the cases may require 2 or 3 visits for all of the surgical part. We may have to place a bone graft that has to heal 6 months, and then place the implants that have to heal 6 months. So you could be looking at upwards of a year, 18 months to complete your treatment. People walk in the door all the time. They won't look at you in the eyes. Their head is down during the initial consult. And to see their confidence grow and to see their shoulders come back and their head held high during the course of treatment, it's like putting water on a little sponge creature and the thing just comes back and they get their life back. That's why we do what we do.